Welcome to Module 1 in the Professionalism series. The series includes 5 modules: Professional Competence and Ethics, Personal Competence, Reflection and Ethics, Interpersonal Communication, Professional and Personal Image, and Social Awareness. In Module 1, we will be discussing Professional Competence and Ethics. The goal of this video is to introduce the topic as it relates to the field of communication sciences and disorders, specifically the disciplines of speech-language pathology and audiology. Professional competence requires us to be knowledgeable about our undergraduate and graduate coursework, as well as our responsibilities as a practicing clinician. First, we will discuss those responsibilities, and we will return to coursework later. As professionals, it is our responsibility to apply the knowledge we've gained to our clinical settings. We are responsible for lifelong learning through continuing education, certification, and advancements in our fields. For example, it is expected that an SLP working with individuals who use Augmented Alternative Communication Devices, or AACs, maintain a working knowledge of the devices, programs, and applications as they are updated and advanced. As health professionals, we are also committed to providing therapeutic methods that are supported by evidence-based practice or a problem-solving approach to clinical practice that incorporates the best evidence from well-designed studies, patient values and preferences, and a clinician's expertise. Throughout our undergraduate and graduate coursework, we will be challenged intellectually. As undergraduate students, we are responsible for maintaining a respectful GPA, both cumulatively and within CSD courses, participating in extracurricular organizations such as NISLA or MC Squared, engaging in other opportunities within and outside of the College of Allied Health Sciences, and earning at least 25 observation hours before attending graduate school. During the graduate level coursework becomes significantly more rigorous and discipline specific. We are still responsible for maintaining a respectful GPA, but also developing competencies and professionalism within our clinical settings. Graduate school is the perfect time to learn and practice aspects of professionalism before entering the workforce, such as dress, punctuality, and communication. Lastly, during this phase of our academic career, we begin to earn clinical hours and competencies and develop an understanding for scope of practice as speech-language pathologists and audiologists, which occurs through various clinical rotations in different settings. Next, we will begin our discussion of professional ethics. Professional ethics are the corporate standards and expectations for behavior and practice set forth by a discipline's national accrediting body, which for speech-language pathologists and audiologists is the American Speech Hearing Association, or ASHA, our places of employment, and our graduate and undergraduate programs. This segment will present professional ethics by which individuals should abide. It will include honesty, integrity, accountability, and altruism. Honesty is a crucial ethical characteristic that professionals within the fields of speech-language pathology and audiology must uphold. It is a pillar for patient-clinician trust and respect as well among work colleagues. Patient care is a primary responsibility, and a significant part of that care is maintaining an honest relationship with the patient. Next is integrity, which can be defined as having strong moral principles, remaining true to oneself, and holding oneself to a high standard of morality and behavior. It is imperative to maintain professional and personal integrity in the workforce. Next, accountability is vital as an individual and a budding professional. Accountability or responsibility can include aspects of professionalism, such as arriving on time, being prepared, displaying a clean and well-groomed appearance, and is also shown by accepting failure and committing oneself to improvement. It can also mean that as young professionals, we are holding our peers and coworkers accountable for their actions and behaviors. As we support our clinical decisions through evidence-based practice and research, it is important that we always credit the sources. Whether it be in writing, speaking, or interpersonal activities, we are responsible for giving credit to an individual or a group of individuals when it is due. We must hold ourselves and others accountable for this matter. Finally, altruism, or the practice of selfless concern for the well-being of others, is necessary to the clinician-patient relationship. At all costs, our responsibility is to our patients, clients, and their well-being, which at times can be at the expense of the clinician. This concludes our module on professional competence and ethics. The next module will discuss personal competence, ethics, and reflection.